We are back here at the Center for Rapid Recovery with Dr. Renee D. Charles. She is going to give our award-winning cameraman, Antonio Kelly, a tour of the facility.
This is our Tuesday evening schedule where people can come in from work between 4 and 8. Come in, whether you filled out an application, you called in online, or you text us, someone's here to help you navigate the process. So generally people would stop here, so I see that. Ask her to come. Mary, ask her to come. Come on. This is one of our coordinators.
Hi.
Compelling people from the street to come on in, and she's registering those individuals to come in who's walking in or who have already registered. Her name is Lisa, and she's doing an excellent job. She's bilingual.
¿Cómo está?
Muy bien, gracias. Estamos aquí para servir a la comunidad hispana, aquí al 312 Greenwich Street. Y si quieren venir a hacerse la prueba y la vacuna, estamos aquí. Nos llama aquí al folleto. Ok, gracias.
De nada.
And see, we shall illustrate.
Y estamos dando también camisas. Y cuando se venga a hacer la vacuna y mascarillas también. So aquí nos vemos al Center for Rapid Recovery. Gracias.
Thank you. Let's see if I can get someone to let us in. And so once they're registered at the front desk, they'll come on in. And they would first check their temperature, of course, like this.
Normal temperature.
Yeah, and see this normal, so that then they were able to come in and sit down and someone would greet them. And then, once you're assisted with the paperwork, we call you. We have some awesome medical practitioners here. We have a physician here. We have licensed nurses, RNs, and those who are here to help explain the process, not just rush you through and rush you out. So you're here, you're going to have an opportunity to relax, to ask questions, to hear some Anita Baker right there, or hear some Fred Hammond while you're sitting and having a great time. Just come on over. I'm going to introduce you to Dr. Phillips. Dr. Phillips, want you say hi? Dr. Phillips is our physician that's guiding the process in terms of making sure that anyone who has a history of illnesses that may or may not, maybe should not get vaccinated. Dr. Phillips, say a couple of things about COVID, Dr. Phillips.
Well, good afternoon. Again, we're at a very critical phase of this pandemic. We got to lean in and get the vaccine to those that don't have access to it or have been reluctant to get it, because only through getting more people vaccinated will we get to a place where we could have this interview without these masks on. So again, if you know somebody that needs to be vaccinated, definitely, direct them this way. We do know what's happening. If you don't get vaccinated, just look at what's happening in India right now as far as how the virus is swarming there. So again, people, we're not over. We still got more work to do. If we want the summer to be somewhat normal, we've got to lean in, we've got to be intentional, and we've got to get vaccinated to make our community safer. So thank you very much.
Thank you, Dr. Phillips. All right, this is our director of the program, Nurse Doreen Dunn. And that she's coordinating everything on a higher level. And right now she's entering all the people who are been tested today and getting the numbers into New York State, and that's part of the process. Mm-hmm. And say hi, Doreen.
Hi, good afternoon. How are you?
Woman of words, huh?
Yeah. Celine. And Celine is one of our medical students from
NYU, Long Island.
And she's with Dr. Phillips, and she's joining us in the community to serve the people that's in need. So we have a couple other people. The other nurse here, RN.
Hi.
Say hi there. And our newest nurse in the back here. She's saying hi there.
Nurse Beyonce, hey man.
Come and get your vaccine. Does a body good.
Very good.
Wonderful.
Very good. So then we had 2 doctors. One was here this morning for the 4th shift. And so right now, once you get your vaccine and you sit down, and then we give you a gift bag of your t-shirts and your masks. And so let me just show you what you're going to get. What's critical, one thing you're going to do, you're going to get a lot of information, 5 cards on the myths that people believe about COVID. Okay. And so we want you to really get the facts and figures about COVID. So you'll see those. Also, sometimes after getting the vaccine, you may go home and feel a little sick. Your arm may hurt, feel a little headache. And nobody really tells you what to do about that. They just give you a shot and you run. But this is a safe card. You can download this app onto your phone from the CDC. If you have any problems, they will call you. We have this in English and Spanish. And some other information about whether or not could you get the vaccine if you were pregnant, what's in the vaccine information. Many people are talking about what's in the vaccine and what's not in the vaccine, how it was developed. I've heard so many conspiracy theories, it's crazy, so we want to make sure that people understand what it is. You also get a COVID mask, a vaccine mask, on both sides because we're going to give you 2 shots. We also have information in the bag about all the services that the Center for Rapid Recovery offers here, and you also will get a t-shirt, whether black or white. And it really will say, this is our telephone number, get vaccinated, Rapid 13. And on front, it will say, A vaccinated. So this is at no cost to anyone. We just want to honor you and let people know that you've taken the bold step to get vaccinated, and you're in the number. Alrighty. So as we enter inside, so as I said, this is a behavioral health care organization. We serve individuals who have addictive disorders, individuals with intellectual developmental disabilities, those who have HIV and AIDS, those who have co-occurring illnesses such as substance abuse and HIV and AIDS. And we have a clinic, it's a medically supervised clinic on this side of the building, where we have medical staff that are serving you. Right now, most of the services are telemedicine. We are now just reopening our face-to-face, and people have an option for face-to-face or telemedicine. So we have a director who leads that program. And as you walk down this pathway, you'll see that we are very visually oriented. We want people to have an opportunity to read information, to see themselves in information. This is part of the lab in here. We have a human resource office. This is more so the administration building, as well as the clinic for people with addictive disorders. Mostly people come 3 times a day, or they're in a group once a week, and 2 face-to-face or telemedicine. So on both sides of the building, we have, on this side of the building is actually the clinic. On this side of the building, this corridor, everything is kind of allocated based on service delivery. It's outreach to people in the community whose child may not be developing at the appropriate age-appropriate developmental rate. So children from birth to 5, a child 2 or 3 years old may not be talking or walking, and some parents don't understand that that's an indicator that possibly they're at risk for a more serious disorder. So we go out and give information about that. We also help people acquire Medicaid for those who don't have Medicaid and need services that can be covered by Medicaid. So we do that as well. And that's called the Bilingual Linkage Program. And then we have a mobile intervention and outreach program that goes to churches, we go to daycares, we go to libraries, we go to anywhere that we could be welcome to share the information, the early alert signs of autism, early alert signs of developmental disabilities, mental illness, mental retardation. So we engage family members in understanding that piece of it. So this is basically offices, a nurse's office, doctor's offices, counseling offices that we would find down here. I don't know if the director is still here. Let me just get a sense. Today's Tuesday. No, he's I think he left out. But this is basically, it's a square that goes completely around.
Okay.
As we go around here back into the board area, and then we have our accounting office on the other side. But this is basically it. And I will show you my office, but my office is a mess.
Okay. I noticed you have some beautiful art on
Thank
the
you.
walls.
I love art. I love the visual. You know, we're visually oriented people. We're touchy-feeling orientated people, and we want to show those who visit here to feel comfortable that this is a home for them. And so over the years, we've collected a lot of art. And then most recently, I just got the art that you see in the room we were meeting at. I had ordered that. That's going to go outside as well. I think that's Alexandra Cortez. I have one for her. It's not filmed yet, but that's the Supreme Court Justice Sonora and famous baseball player. And so this is the exit you went out. This is a portrait my grandmother painted years ago. Yeah. My mom brought this back from Kenya, this one here. She brought that back from Kenya back in the early 90s. Yeah, so we're trying to make it comfortable so that people can see themselves, not only see themselves recovering, but see themselves as CEOs, see themselves as directors, see themselves. Very rare do you see a black CEO, a black CEO female. So I want the clients to see that we are together and that we can achieve whatever we want to achieve. So that's where the comfort is, you know. So that's it.
Now that you have seen what is available at the Center for Rapid Recovery, we invite you to come in and utilize our service and staff. We are here in the community and for the community. God bless you all.